So good evening, everyone. Myself, Dr. Tanima Singhal, and I welcome you on today's Q&A session. So all those who are live right now, if you have any questions, you can put it in the chat box. And others, I will first start taking the questions which you have filled in the Google form, and then I will take the live questions. So who all have any questions, you can put it in the chat box, and I'll answer them. And let me also see that everybody is muted so that we don't get disturbed. So yeah. So you can put your questions in the chat box. First, I'll start the questions in the which are there in the Google form. So first question is from Mamta Sharma. My baby didn't latch from birth. He's 3 month old now. So if your baby has not latched from beginning, like from birth, and the baby is already 3 months now, I am very sure you would have tried a lot of things working on your latching and everything. But right now, my question to you is that uh, what are you looking for? If you are feeling that your milk supply is good, you're pumping, and you want to get the baby on the breast, is this your question? Or there is no milk supply, the baby is not latching, the baby is taking only formula. Is this your question? Or what is your question? Because you have just told me about the things, you have not put your query. So it's a request to everyone who all have their questions. Put your questions specifically so that I can answer. Just not giving me proper context to what is your question, I will not be able to answer your questions that way. So okay. Next question is from Rama. Cracked nipples and low milk supply. So for cracked nipples, always remember if the mother is facing cracked nipples or sore nipples, it is basically a latching issue. If your baby is latching only on the nipple part, the nipples will get cracked and they will be sore and later on might have bleeding also. So anybody who has pain in the breastfeeding or like that, it means your latching is shallow. You need to work on your latching. For low milk supply, I will answer because this is a very common question. Mothers keep asking every time. So I'll wait for some time and then I'll answer this. Next question is from Kalyani. I do pumping regularly after each feeding session, but my milk supply don't increase. I am following all the protocols as per your saying in the clips. So always remember, if you're a breastfeeding mother and you start pumping, then ultimately your aim is not to get milk in the pump. If you want to increase your milk supply, if your baby is already latching on the breast, then obviously the baby will take over all the milk. You will not get anything in the pump. Then why are we pumping? If you are giving formula milk, then pumping gives your brain that extra stimulus to increase the milk supply. But if you're not getting anything in the pump, that doesn't mean that your milk supply is not increasing. Because if your milk supply is increasing, the baby is emptying the breast and you're not getting anything in the pump. Simple logic. So don't focus on output of the pump. Just do it to give your brain that extra stimulus to make more milk supply. Okay? So our final aim for all the breastfeeding mothers, the aim of the pump is not to get the milk. It is to give your brain that extra stimulus to make more milk supply. All the breastfeeding mothers, if you are pumping, please don't expect milk in the pump because that is what we don't want. We want the baby to take over all the milk. We are pumping just to give that stimulus to your brain to make more milk. So if you're an exclusive breastfeeding mother, you're not giving any formula, then you don't need to pump. Okay. Next question is from Rekha. The 1 month baby won't latch properly. How to practice latching steps? See, latching is one thing which requires a lot of skilling. Latching is something where both you and your child have to learn the latching correctly. Once you both are skilled properly, you will be able to latch longer time for a like longer period, 2 years and above. So latching is something that you need to have a call with our latch expert and work with her so that she will teach you the right latching techniques with different positions and all that. That will be more useful for you. On a random basis, I can say that cross cradle hold works best for everything. So what is a cross cradle hold? If you have to feed from the left breast, then you have to hold the breast in left side and have the baby hold the baby from the right hand. So this way, this is a cross cradle hold position. And how to hold the breast? Don't hold it C shape. You have to hold in U shape. U shape from below and press the breast so that the areola is spouted and the baby can latch. While babying the latch from the opposite breast, make sure the baby opens a wide mouth. To tickle the nipple on the baby's upper lip, the baby will open a wide mouth and then you latch the baby. This is a general guideline what I can tell you about latching on a general platform. But if you need more help into this, you need to have a call with our latch expert. Next question is from Kritika Singh. My baby is not drinking my milk. So, what is the issue? Is the flow an issue? Or is the baby habitual to the bottle? That's why the baby is not drinking? Or is the baby going through some nursing strike? Is the baby not? So, these are the reasons why the baby will stop feeding for without any reason. So, these are the things which you need to work upon, Kritika. First, you need to understand why is the baby not drinking, and accordingly you need to work accordingly for that. Next question is from Bhargavi. Low milk supply. I'll answer that. Latching issue, low milk supply, need more milk supply. Okay. So now all the next questions are basically about low milk supply, and Tanushri S has mentioned pain. So what pain? Like what do you mean by pain? You have to put it in the chat box properly that what do you mean by pain, so that I understand, is it nipple pain you're talking, is it breast pain you're talking, what kind of pain you're talking. Okay. So next is, now let's talk about low milk supply. So first, always understand what is the reason behind low milk supply. Nature will never do something wrong. If your body can nurture your baby well during pregnancy, what happens after delivery? After delivery, when the baby is born, the milk is there in the mother's breast. But if there is not enough stimulus for your brain or your breast, then the letdown doesn't happen. Now, what happens usually if your baby is born natural by normal delivery or by cesarean? The baby is cleaned and baby is given to the people, and everybody tells you that okay, you try after 2 3 days. Initially, 2 3 days you will not have milk, and all those things keep happening. So the mother thinks that okay, let me try after 2 3 days, and what happens during that time, because the baby is given formula milk, and that to a bigger amount of formula milk, the initial letdown doesn't happen and the mother doesn't the milk doesn't flow, and the baby gets habitual to the formula, and especially that formula, if it is given by bottle, the baby likes that flow. And also because formula milk is loaded with sugars and preservatives, the baby starts liking the taste of that. And once after 3 4 days, when the mother tries to put the baby on the breast, the baby refuses. Or the milk is, suppose the milk is not coming, the mother feels very less confident about her milk. She feels my baby is drinking 30 ml at a time and I am not producing enough. I am producing only drops. So the mother feels underconfident about it. And all these things keep happening, and the situation comes to a place where the baby starts taking formula the most of the times, and the mother is producing only 10 15 20 ml, and she feels very underconfident. So to in order to really to work on this, we have to first work on the demand and supply. So the best thing is that once the baby is born, within half an hour the baby should be put on the breast. Now if you're a pregnant mother who is listening to this video, then you have to follow this. Now, if you are already a mother and your baby is already born and this was not done, or it was done but still you are having low milk supply, then you can easily resolve it by working on the demand and supply. Now, talking about demand and supply, if your baby is directly breastfeeding maybe 2 3 times, maybe more, but still you are giving formula milk, and then after every direct feeding, just pump for few minutes. This will give an extra stimulus to your brain to make more milk. Don't expect milk in this part, but your work is only to do pumps. Now, if your baby is not at all coming on the breast, then you have to make sure that you are pumping regularly at like same interval of time, so that there is a regular stimulus to your brain to increase the milk supply. So this is about demand and supply. Second thing is you have to prepare your body and mind. So one is hydration. Second is the flow. So do oil massage and warm compress. Third is galactagogues. So galactagogues. Now let's talk about galactagogues. So galactagogues are the supplements or the food ingredients which are advised for new moms to increase their milk supply. Now everybody these days are very busy. Everybody wants some easy solutions. Tell me some powders, or tell me some tablets, I will take. I agree. It becomes easy as a mother because you don't have time for making all those nuskhas, and many times mothers don't know what proportion to put. So I understand that okay, taking supplement is fine, but what kind of supplements? Now, when we talk about the common brands which are available in the market, if you whatever brand you are using, just make sure that you check the ingredient side, and below the ingredient you have to check the preservatives added. So if you are using preservative, like if the lactation supplement, whatever you are taking, has got preservatives like sodium methyl parabens, propyl parabens, or sodium benzoate, then it is not advisable. Why? Parabens we don't use in shampoos and creams also. We use paraben-free shampoos, paraben-free creams. Now, these supplements which has got parabens and we are taking them inside our body, then you can imagine the it's not good for you, for your baby. So you need to make sure the lactation supplements which you are using should not have any preservatives like methyl parabens, propyl parabens, or sodium benzoate. So whatever you are using, just today check it what preservatives it has. And if it has preservatives, I will not recommend using it. Now, talking about this, then what can we use? So the preservative-free lactation supplements which I suggest is Lactomagic powder and Morico tablets. This you can take. Now, next part is keeping the baby skin to skin. So, if your baby is already a breastfeeding baby, then during breastfeeding, just open baby's clothes and keep the baby skin to skin with you. If your baby is not at all latching, then during the burping time, hold the baby close to you. Last thing is you need to track everything. How to track? You have to track your baby's weight gain. You have to track your baby's formula intake. So by tracking these two things, you will be understanding what are the milestones, and accordingly you will be able to track your results. And don't focus on amount or quantity of breast milk. The composition of breast milk also changes once you start working on your milk supply. So the tracking of weight and tracking of formula is very important to know that what are your milestones, what is the progress of whatever you are working in that. Okay, I hope this is a detailed answer about low milk supply issues. You need to follow these tips. This will help you. Now many of you would be thinking, I have tried most of the things, but the things are not working as it should have been. Then I would invite you to join our team. So I have a team of experts. I have lactation experts in my team of clinic, and we have a latch expert, we have dietitians in our team. You are most welcome to join, you to take help from us. So we have consultations, including me. I also take consultations. My team of doctors also take consultation. So you can reach out to our team. So I have given the details in the description box of this video. You can go through them, and you can reach out to the inquiry team and just have a conversation with them that what kind of consultations will be good for you, and accordingly you just take the consultations from our expert doctors. So this is what I can help you all with. Now any questions if you have in live in the box, you can just put it in the chat box so that I will answer. So Shreya Chatterjee has put her question. Hi ma'am, my baby is 6 weeks and he's trying to latch but no milk supply now. So Shreya, I have just shared the tips and tricks of how to increase the milk supply. But your baby is 6 weeks, so baby is going through a growth spurt. It's good that the baby is latching. This is a good time that you can get increase your milk supply and get your baby on exclusive breastfeeding. You can easily do that. So Shreya, if you have tried different things, because I understand for last 6 weeks you would be trying different things. So if you have tried a lot of things and the milk supply is not increasing, then obviously you need help at a priority basis. So you are most welcome to reach out to our team and take help from them, or you want to take help from me, anything. We are all there for you. Just reach out to the inquiry team and get your consultations done like scheduled. Any other questions, girls? Anybody who has any question, please put it in the chat box. I don't see any new questions, so I think all of you who are here don't have any question. Good to know that you all are like knowing everything and you don't need any further help into that. Great. So take care, everyone. We'll meet every Friday. We meet every day, every Friday 9 p.m. If you have any questions, any doubts, you can keep it with you. You can ask me. The Q&A sessions Otherwise, if you are already a part of any of my team of doctors or my team, you can ask us one on one during the consultation calls. So that's all from my side. Take care, everyone. Bye bye.